Medical imaging sits at the core of modern healthcare, driving diagnosis, surgical planning, and precision-led treatment. But interpreting this data requires more than theoretical knowledge. The industry demands professionals who can work with real clinical imaging workflows. Traditional learning builds strong fundamentals, but often lacks exposure to how medical imaging is applied in practice. At SRM Institute of Science and Technology, this is being actively addressed, with a focus on advancing biomedical education through applied learning. At SRM University, MySegmenter by 3D Surgical bridges the gap between theory and real-world clinical workflows through hands-on imaging data.
So this collaboration with MySegmenter, with the Biomedical Engineering Department SRM, will help the student to understand the current trend in the imaging, particularly related to biomechanics. This will help them with the newest technologies or the challenges that are faced in the healthcare technologies. Also, this is implemented in their biomechanics curriculum as laboratory courses. And for this, with this collaboration, each student has access to this software, which will help them in learning this software hands-on. Also, with this software, they are using real-life CT data for segmenting and all the other complex post-processing, pre-processing of the data, which will help them in understanding the overall process flow of the biomechanics, implant design, and everything.
As medical imaging continues to evolve, practical proficiency is no longer optional, it's essential.
So, from the student feedbacks that I received, this MySegmenter, first thing that I understand that the MySegmenter is very easy to learn for the student. The learning curve is not that steep. Okay, so this is the MySegmenter. What we will be doing, this is a CT scan of a femur bone. As you can see, we have the soft tissues and the hard tissues, everything. So what we will be doing, we will be segmenting this thing. So we'll be extracting the bone from this complex image. So this process is called segmentation. So what we basically do, we color these bones, okay, in green, as you can see. So we apply this segmentation, and you can see we have the bone. With that, if you want to use with a particular region of interest, from this we can extract that particular bone and work for designing implants or taking some measurements and for all these purposes.
By integrating real workflows into education, MySegmenter enhances how students learn, apply, and transition into the industry.
Using MySegmenter, we were able to segment different type of the bones in the human body. It was very easy to accessible, and I was able to learn how to segment different type of bones from skeletal systems.
MySegmenter by 3D Surgical, bridging industry and academia through real clinical technology.
From my teaching perspective, it's easy to handle and teach this software to the students due to its easy to use features and the easy UI to understand.
Partner with 3D Surgical to transform how your students learn. Schedule a demo today. Contact at 3dsurgical.com.